Welcome to Meet Your Toastmaster podcast. I am Toastmaster Neumal from Coroner and Kegalle Toastmasters Club. Today I have a very special guest from Kegalle Toastmasters Club. She is a medical professional and anesthetic and the current president of Kegalle Toastmasters Club. Toastmaster Prarthana Lienarachi. Toastmaster Prarthana, how are you?
I'm doing fine. Hope you also doing fine.
Yeah, I'm doing really great, Prarthana. So, as to my first question, I am a bit curious about what is this anesthetics and anesthesia. For people like us, laymen, we don't know much about these medical terms. We only know doctors. If for whatever it is, we refer them as doctors. So would you please mind on elaborating on what is this anesthesia and anesthetic? Please?
Actually, an anesthetist is a doctor who provides the anesthesia, and anesthesia is a vast medical field. But in simpler terms, anesthesia is basically to make a patient pain-free and a surgeon hassle-free during a surgery. But this anesthetist work going from before the surgery and until the full recovery of the patient.
Wow, that would be really helpful. And if we talk about anesthesia, now let me say so every medical procedure there are some variations. What are the different type of anesthesia? Would you mind please explaining us?
Yes, sure, Neoma. There are a lot of ways to give anesthesia, but basically there are two types. The first type is general anesthesia, where you make the patient fully unconscious as a whole body. And if it is required by the surgeon, we would paralyze the patient at the same time for the easiness of the surgeon, as well as for the easiness for us to make him breathe for the whole time of the surgery. And the second type is the regional anesthesia, where we give the anesthesia only to a site of the patient. That means the concerned area of the surgery. For an example, when it comes to the seizures, we give spinal anesthesia. That means we give a block to the spinal level so that the below levels of that spine nerves will be blocked, so the patient will be pain free and there will be a lot of paralysis so that the surgeon can perform the seizure without any hassle. And these kind of blocks, major blocks of the nerves, are called regional anesthesia. So general anesthesia and regional anesthesia are the basic types of anesthesia.
That is a really interesting explanation. I am pretty sure our audience also have learned a lot about this anesthesia and the various methods. Thank you for your detailed explanation. Now, if I talk about my own experience, I remember when I was going through one of my operations, I was told that you have to fast. Why they are too much worried about this fasting? What is the correlation between the fasting and the medical procedure, specifically operation?
Yes, Niyama. Sometimes we worry about the food, about the patient more than the patient's family members. And if I have to anesthetize the patient, the very first question I would ask is about the fasting. That is because of the stomach and its contents. When we make a patient unconscious, or let's say paralyze the patient with a regional anesthesia down, then the patient's stomach functions will be deteriorated or maybe malfunctioning because of that paralysis. And on the other hand, if the patient is fully unconscious, that patient's epiglottis functions are also affected. In this case, if there is any content inside the stomach, that will flow up to the throat, and then it will flow down to the lungs, which will cause aspiration. And this can be quite deadly to the patient. So we need to keep patient's stomach empty during a surgery To make the stomach empty, we need at least 6 hours fasting, so that during that time, all the contents in the stomach will be going down to the bowels, so that we will be in safe hands. That's why we are so much worried about fasting.
Really interesting. I think I should be thankful for the doctors for inquiring me about my fasting and how what I have eaten. Now I understand the importance behind this inquiry. I am pretty sure you all have to be so nice and be cooperative with doctors when you are also undergoing an operation, because these things are really crucial for your own betterment. We talked a lot about the subject. I want to know now. Some people say this anesthesia, the field is really complicated and also a very stressful one. So why is that kind of a concept is there? What do you think about that?
Yes, Neomal. According to the medical researchers in medical profession, anesthesia is concerned as one of the most stressful fields. That is because we take the charge of a patient's whole body functions during a surgery. Now, let's say we have made the patient fully unconscious, then the patient's breathing, heart rate, and all the functions we have to take charge, and we have to operate those things artificially until the patient comes into the full recovery. Now, that maybe it is a routine case where the patient is fully healthy and we made him sedated or unconscious, then his breathing will be stopped. Then we have to take it into our count and we have to make him breathe for next 2-3 hours until the surgery is finished. This is like aircraft pilot's job. Now, the aircraft pilot can check on the aircraft and make on the fuel status and all the other functionings of the engine before proceeding. But once the pilot has taken off the aircraft, he can't do anything about that, but to make sure that he is safely land in the aircraft at the correct destination. In the same way, the anesthetist has to do much more checkups and optimizations and doing some kind of medication before giving the anesthesia. And once you have given the anesthesia, it's like flying off an aircraft. We have to take charge of it until it is safely landed on the correct destination. And in anesthetist context, we have to safely recover the patient after the anesthesia. So this is a full kind of context of work. So it is much more stressful to get the responsibility of a patient fully in hand.
Cool. I hope that you have safely landed all the aircraft you have flown so far.
Yeah, of course, yes, because we are checking up on the patient before proceeding. And I'm so much happy that I have selected this field. Though it is stressful, we can do miracles and we are gifted with a lot of skills to give the service to the people.
That would be great. I have another question. While you were explaining those proceedings and you were sharing those knowledge, I am pretty sure that there will be a lot of people in this audience also would be aspiring to become a medical professional. So why don't you explain them the process or the qualifications and or what are the actions they have to take if they are willing or if they aspire to become an anesthetist? Would you mind?
Yes, Neomal. Actually, the first thing you have to do is you have to obtain an MBBS degree. For that, in Sri Lankan context, you have to pass the GCSE levels with flying colors, so that you will be taken into a local university, or else you can go for a foreign graduation and then obtain an MBBS degree. Then you have to do 1 year's full-time internship in Sri Lanka to get the SLMC registration. And once you have obtained that, then you can select an anesthesia appointment. Now, in my case, I'm a medical officer in anesthesia, not a consultant in anesthesia. Now, I am given the procedure to become a medical officer in anesthesia. Once you have done your internship, then you can proceed with the full-time training in anesthesia under supervision of consultant anesthetist for 6 months duration. After 6 months, your training is complete, but to make it official, then you have to sit for an exam and you have to face a viva by College of Anesthetists called 1A exam. Then you are a fully qualified medical officer in anesthesia. If you want to become a consultant in anesthesia, then of course you have to obtain the 1A with the proper training of anesthesia. Then again, you have to face a lot more exams in the coming years and more years of training full time in Sri Lanka as well as in a foreign country. Then you have to come back to Sri Lanka and then get the board certification to practice as a consultant anesthetist. So it is a long way process, but many medical professionals go for anesthesia because it is a wonderful subject to follow.
Wow. So you have to put up a lot of effort if you are really willing to be anesthetic.
And the thing is, an anesthetist means a fully trained subspecialized doctor. So you can have the faith on anesthetist, and that's why many people go for surgery without any fear.
Indeed, we all are grateful to you. Doctors are doing a tremendous job. And I want to relate my last question for that. I know you are also undergoing a very hectic schedule, Prarthana. So are all doctors. Because of this current pandemic situation, we all are in kind of a bit alert situation. So, as a medical professional, what is your advice to the audience as a whole?
Actually, Nirmal, when it comes to the COVID pandemic, now most of the people are aware about the symptoms of COVID and how the corona fever comes up. Mainly, there will be respiratory symptoms like breathing difficulties, running, the heavy nose and sore throat, and the fever. But in anesthesia context, I must say you, now anesthetists take care of the ICU care as well, intensive care unit services. Now, in that case, we see a lot of patients going to the severe forms of corona fever. In that case, the anesthetist have to put a tube inside the lungs sometimes, depending on the difficulty of breathing. So in that case, if you have any symptom of corona, I must request all the citizens in Sri Lanka, please don't wait until you get the symptoms severe, until you get the shortness of breath and sometimes failure of your organs. Please come to the hospital and get your proper medication, notify your PHI and the MOH so that the high-fi procedures of corona management would not apply to yourself. And on the other hand, if you have such kind of symptoms, please come without eating and drinking at the last moment as well. As I told you, even for the patients who are having this kind of symptoms, we will have to put a tube after giving anesthesia. So the same theory of fasting will be applied to these patients as well. So that is what I have to tell you. So it is a very pitiful situation to go into an ICU with corona. So please take care of you with the safety distance and wearing mask and minimizing the social events so that you all will be safe and we won't have to do any kind of anesthesia work to the people.
Thank you, Toastmaster Prarthana and Doctor, for your valuable information and sharing your wisdom with our audience today. I know you are really busy and still you managed to reserve me a time and agree to participate for our podcast episode. I would be really thankful for you and wishing you all the best. Thank you.
Thank you so much, Nirmal. And I think this is a great opportunity for me to take in this podcast with you, Toastmaster Nirmal, and I wish you all the best. And thank you for giving me this opportunity to share some experiences and knowledge about anesthesia, because in Sri Lankan context, the people really know very little about anesthesia. So I think this is a great opportunity for me to open their eyes.